Welcome to QPI Healthcare Services. I'm Professor Q, and I'm excited to introduce you to how QPI can support you in successfully operating your durable medical equipment company. At QPI, we understand the complexities of the healthcare industry, especially when it comes to compliance, accreditation, and operational efficiency. That's why we've developed Lavear H.A.R.P Lite technology, a powerful digital platform designed to streamline 4 critical areas of your business: human resources, administration, risk management, and patient outcomes. Our innovative system helps you simplify compliance, boost organizational efficiency, and drastically reduce your day-to-day workload, so you can focus more on care and growth and less on paperwork and processes. Let me show you how QPI and Lavear can transform your operations and set your DME company up for long-term success. At QPI Healthcare Services, we are a virtual healthcare compliance administration company committed to helping DME suppliers stay aligned with payer requirements, accreditation bodies, and regulatory agencies while streamlining operations and reducing administrative burdens. Our expert team brings deep knowledge in healthcare operations, education, analytics, and regulatory oversight to ensure a seamless compliance process. To further support providers, we developed Lavear H.A.R.P Lite technology, an innovative compliance software that tracks accreditation and survey readiness, monitors compliance metrics, and boosts operational efficiency in real time. With automated tools and advanced KPIs, Lavear empowers providers to stay ahead of evolving regulations, improve patient-centered care, and achieve long-term success in today's complex healthcare landscape. Noncompliance with state and federal laws, payer regulations, and accreditation standards can result in denied payments, sanctions, billing deactivation, and compromised patient safety, making real-time compliance monitoring critical for financial and operational stability. Lavear H.A.R.P Lite technology enables providers to instantly track compliance levels and proactively respond when metrics fall below 75%, automatically detecting issues, notifying personnel, and initiating resolution efforts. This intelligent, automated approach helps mitigate regulatory risks, maintain accreditation readiness, and ensure uninterrupted billing and care delivery. By leveraging Lavear, healthcare organizations can stay ahead of changing regulations, reduce administrative burdens, and stay focused on delivering high-quality patient outcomes. QPI reduces organizational workload by managing HR, administration, risk management, compliance, patient experience, credentialing, accreditation, and technology integration. Services include staff training, policy maintenance, quality control, regulatory compliance, payer enrollments, and operational streamlining through Lavear's H.A.R.P Lite technology, allowing providers to focus on patient care. At QPI Healthcare Services, we simplify HR compliance through Lavear's web portal, which provides real-time tracking, reporting, and verification to keep organizations audit-ready and aligned with accreditation and payer requirements. By automating HR processes, providers can reduce administrative burdens and stay focused on patient care. Lavear's HR Access tabs monitor key elements such as employee applications, quarterly background checks, SAM, OIG, PACER, sex offender registry, policy acknowledgments, orientation checklists, job descriptions, performance assessments, and IRS documentation. This automated system enhances workforce oversight, mitigates risk, and ensures ongoing compliance and operational success. At QPI, we prioritize ongoing education, credentialing, and licensure tracking to ensure patient safety, regulatory compliance, and workforce competency. Our mandatory education modules promote safety and quality standards, with certificates automatically stored in Lavear for real-time compliance tracking. We monitor continuing education for licensed practitioners, such as respiratory therapists, and immediately alert leadership of expired licenses or incomplete CE requirements. QPI also manages the full credentialing process, actively tracking certifications, licenses, and renewals to uphold high professional standards. By integrating these functions into Lavear, we help healthcare organizations minimize compliance risks, streamline operations, and cultivate a culture of continuous learning and patient-centered care. According to the IRS, Maintaining accurate records is critical for tracking business progress, assessing financial health, and ensuring compliance. And QPI helps DME suppliers achieve exactly that. We implement structured, automated record-keeping systems that reduce administrative burdens, improve compliance, and ensure audit readiness. QPI supports 100% readiness across key areas, including corporate structure management such as legal documents, tax filings, operational policies, accreditation organization management to include ACHC, BOC, CHAP, HQAA, the compliance team, the Joint Commission, and American Board of Pharmacy. We implement, monitor, and maintain provider credentialing by focusing on provider qualifications, payer enrollments, state HME licensing, and more. By streamlining documentation and compliance tracking, we help organizations mitigate risk, boost efficiency, and stay prepared for audits, reviews, and regulatory assessments. Accurate record-keeping is vital for business success and regulatory compliance, as emphasized by the IRS and OIG, enabling healthcare organizations to monitor progress, expand services, and meet federal, state, and accreditation requirements. QPI Healthcare Services ensures 100% preparedness by managing essential corporate records and compliance documentation, including articles of incorporation, state licenses, EINs, insurance policies, tax permits, lease agreements, and surety bonds, keeping providers legally operational and financially sound. We also support accreditation efforts through survey preparation, change management, corrective action planning, and accreditation tracking. With web portal access, DME providers can monitor compliance in real time, ensuring audit readiness. By partnering with QPI, organizations streamline compliance processes, reduce administrative burdens, and stay focused on delivering high-quality, patient-centered care. Effective risk management is essential for ensuring safety, quality, and regulatory compliance in healthcare, and QPI Healthcare Services supports organizations by identifying, assessing, and mitigating risks through proactive strategies aligned with payer and accreditation requirements. Our risk management team also responds to sentinel events with thorough investigations, root cause analysis, and corrective action plans to minimize harm and prevent recurrence. By integrating incident management, compliance monitoring, and quality improvement, QPI helps providers enhance safety protocols, reduce financial and legal exposure, and maintain operational efficiency, ultimately fostering long-term regulatory success and patient trust. DME providers must continuously monitor local, state, and federal regulations to maintain compliance, protect their business, and ensure quality patient care. QPI Healthcare Services provides comprehensive regulatory oversight, accreditation management, and payer compliance tracking to help providers stay ahead of industry changes. Through medical record audits, MedWatch bulletin reviews, and policy updates, we identify compliance gaps and mitigate risks. In addition to compliance, QPI strengthens performance and risk management with annual evaluations, quarterly reports, and SWOT analysis to uncover operational efficiencies and growth opportunities. Our liability assistance educates providers on legal risks and proactive prevention strategies. By staying current with healthcare laws and refining workflows, QPI ensures DME suppliers remain compliant, financially sound, and patient-focused. QPI promotes compliance, patient safety, and operational efficiency through quarterly virtual risk assessments that deliver real-time insights, enabling early intervention and continuous improvement to prevent compliance violations, liability issues, and operational disruptions. Each report includes a variety of audit data that supports patient record audits, HIPAA assessments, safety and fire drill evaluations, sentinel event reviews, and patient survey analysis, plus more to strengthen documentation accuracy, data security, emergency preparedness, incident response, and service quality. By integrating ongoing virtual risk management with structured quarterly reporting, QPI ensures organizations remain audit-ready, compliant, and focused on enhancing patient outcomes while minimizing administrative burdens. Credentialing is vital for DME providers to ensure recognition by accreditation bodies, state regulators, and insurance payers, enabling legal operation and reimbursement. QPI Healthcare Services manages all aspects of state licensing applications, renewals, and compliance to keep providers fully operational and aligned with regulatory requirements. Beyond licensing, we handle payer credentialing to maximize reimbursement and expand patient access by securing and maintaining in-network status with Medicare, Medicaid, and private insurers while tracking renewal deadlines. QPI also creates tailored credentialing strategies based on provider specialties, service areas, and patient demographics. By managing the complexities of DME credentialing and HME state licensing, QPI ensures compliance, financial optimization, and allows providers to stay focused on delivering quality patient care. QPI supports healthcare organizations in improving patient outcomes and experiences by monitoring, analyzing, and reporting key findings through structured data collection. We empower DME providers to make informed decisions that enhance care quality, streamline operations, and maintain regulatory compliance. Patient experience surveys assess service satisfaction, while patient outcomes reporting tracks treatment effectiveness and adherence to prescribed equipment, promoting patient-centered care. Additionally, QPI manages grievance and resolution reporting to identify recurring issues, implement corrective actions, and ensure timely resolution, strengthening patient trust, satisfaction, and regulatory readiness. By fostering a culture of continuous quality improvement, QPI helps providers optimize service delivery, improve care coordination, and achieve better healthcare outcomes. QPI streamlines compliance and administrative tasks for DME suppliers by reducing paperwork and operational burdens through Lavear's automated compliance monitoring, which manages documentation, credentialing, and payer requirements, freeing providers to focus on patient care. Our education and training programs keep teams up to date on regulatory changes, accreditation standards, and best practices. In addition to compliance, QPI proactively manages risk to prevent incidents and minimize future liabilities. Our patient outcomes and engagement strategies improve care quality, satisfaction, and adherence, driving higher retention and patient volume. By optimizing billing processes, expanding credentialing, and reducing inefficiencies, we help organizations boost revenue and achieve long-term financial sustainability. Partnering with QPI ensures compliance, security, and operational success in delivering high-quality care. The national average annual salary for a durable medical equipment office administrator ranges from $40,000 to $70,000, with an average of approximately $56,250, while the cost for you to do the Q is between $10,200 to $18,600 annually. Can your practice afford not to do the Q? In today's highly regulated healthcare environment, neglecting compliance, payer requirements, and risk management can result in delayed payments, accreditation setbacks, liability exposure, and financial instability. QPI Healthcare Services delivers comprehensive compliance management, administrative support, and strategic risk mitigation to ensure audit readiness, operational efficiency, and revenue growth. Without Lavear's H.A.R.P Lite technology, your practice faces increased workloads, inefficiencies, and revenue loss. By doing the Q, you gain real-time compliance tracking, automated reporting, patient engagement tools, and optimized workflows, empowering your team to reduce burdens, improve outcomes, and drive financial success. The real question isn't whether you can afford to do the Q, it's whether you can afford not to. Thank you for partnering with QPI Healthcare Services. It has been our pleasure to guide you through the DME industry, offering insights into compliance, accreditation, risk management, and business optimization. At QPI Healthcare Services, we are dedicated to helping DME suppliers navigate industry challenges with confidence. If you need assistance or have questions, we're here to help. Call us now and let's work together to ensure your organization thrives in today's regulated healthcare landscape. Thank you for trusting QPI Healthcare Services.